which involves the Kenya Medical Supplies Authority, which apparently is entangled in a fresh 1.2 billion shilling procurement scandal.
Now, this has been revealed by the National AIDS and STI Control Program, that's NASCOP, which says it has not received supplies of a drug called Septrin, prescribed for patients to protect them from opportunistic infections.
And over 1 million dependents have had to buy the drugs from private hospitals, and the majority who have not been able to have been who are even more vulnerable during the COVID-19 pandemic have gotten it even worse. Let's take a look.
According to a letter dated 1st September this year from the Ministry of Health Principal Secretary Susan Muchache to the Kenya Medical Supplies Authority Acting CEO Edward Njoroge, the Ministry of Health authorized KEMSA to procure Septrin tablets, also known as Septil, on 24th January 2020 under the Universal Healthcare Program funding. Sources close to the investigations reveal the funding amounts to 1.2 billion shillings. Septil is a highly dependable medicine used by HIV/AIDS patients to fight opportunistic infections. The Ministry of Health's purchase of the highly prioritized drug was 1.2 billion shillings for this year alone. However, NTV has established that no single drug has been delivered at KEMSA warehouses, despite the supplier winning a tender to provide the drugs, putting millions of HIV/AIDS vulnerable patients at great risk, especially at this time when the country is fighting the coronavirus. NTV Investigates has also established that public health facilities ran out of stocks for Septil by end of April 2020, creating a health crisis in the country. As a result, many patients have been forced to source the medicine themselves, with those unable to afford being forced to go without it and consequently putting their lives in great danger.
ARVs zinaanza na Septrin. So unapata mtu hajameza hizo Septrin, unapata immunity yake inarudi na kwa low. Kwa sababu sasa hapo ndo kuna kitu inaitwa VL. Sasa tutapata VL zake zinapanda, virusi zinapanda. Sasa inakuwa ni changamoto, unapata mtu anafia kwa sababu last week tulikuwa na kesi, tulipoteza mmoja. Aliaga, lakini tulipoteza after sisi kutojua. After tulijua ndio sasa tukaanza kuria.
Ujumbe wangu kwa serikali ni kuwa wajaribu sana wa supply na madawa, kwa sababu wale watu wanaumia. Ukweli pale tukienda madamu utapata wanaumia. Hawana chakula, hawana nini. So serikali waone vile wanatoa, wanatuletea wanawaletea dawa and then waone vile wanawasaidia. Jua kuna mtu anawasaidia ukweli. Ule mtu ako tu pale hana hata mbele wala nyuma. Na ukimwangalia anasema sasa yeye anangojea kifo, sababu kama ni corona, HIV pia imemfinyilia chini, hana kitu anafanya.
Septrin ilikuwa ni free, but sasa kulingana na hii janga la corona ndio imefanya saizi Septrin ilianza kuanzia March venye corona tu ilianza. Ndio sasa hapo ndio watu walianza kulalamika, wakaanza kusema wameambiwa wanunue Septrin hazipatikani.
Documents seen by NTV reveal that NASCOP has been making close follow-ups on the issue with KEMSA, with most of the time no responses received or false hope responses. According to the contract, the first batch of the supplies was to be made in July, with the second batch representing 30% supposed to be delivered by 27th July. The final consignment was to be made 2 days later at KEMSA warehouses in Embakasi. A tablet of Septil cost 10 shillings, with HIV/AIDS patients needing 1 tablet a day. There are 1.3 million vulnerable Septil dependents, with 1.5 HIV/AIDS NASCOP dependents in the country. KEMSA has been ordered by the Ministry of Health to provide detailed report by Tuesday, the 8th of September, on ending the stalemate, with the manufacturer instructed to alleviate the suffering the soonest time possible. Those are not the only issues currently facing KEMSA at the moment. The Joint Senate Committee investigating the KEMSA COVID-19 procurement scandal will start scrutinizing names of beneficiary companies and directors after it formally received the much-needed documentation from the authority. The parliamentary watchdog is seeking to establish when the companies were registered and whether they paid tax to the Kenya Revenue Authority. Seth Olale, NTV.